Okay, this lecture is part 4 of Is It All the Same Disease? We'll start out here talking about atherosclerosis. Two main types of atherosclerosis. There is the standard Western atherosclerosis from high-fat diets, especially coronary artery disease, the arteries of the heart. There's the Asian atherosclerosis, primarily intracranial atherosclerosis. They eat a low-fat diet, but they have a lot of hypertension because they smoke lots of cigarettes and eat lots of sodium. This especially comes out of the Japanese in the 1960s. They eat 12 to 14 grams of sodium per day. Okay, now we talked about the red blood cells and their zeta potential. So the zeta potential is a negative charge on the outer surface of the red blood cell. And two red blood cells will have a negative charge, so they'll repel each other, which is good. You don't want them to stick together. Okay, a molecule that has a positive charge and is big enough to overcome the zeta potential and stick two red blood cells together, that is called a bridging molecule. A typical example is an IgM antibody, part of the acute immune system response to an infection. The smaller IgG antibody just isn't big enough to hold the two red blood cells together. Okay, here's what the glycoproteins look like on the surface of a red blood cell. There's the core protein, and glyco means sugar, protein means protein. So this is the sugar component, sort of like repeating disaccharide. Heparan sulfate's typical sugar in the glycocalyx. The sulfate, whenever you hear the word sulfate, think of a negative charge. That's all you need to know about a sulfate for our purposes here. Negative charge. So all these negative charges from these glycoproteins. At the end of the glycoprotein, there's a sialic acid that also has a negative charge. Within the plasma membrane of these cells, there's also negative charges from cholesterol sulfates. One thing you should notice is the water molecules are a little bit asymmetric in their charge distribution. It's called dipoles. And what that means is the hydrogens are slightly positively charged. The oxygen has a slight negative charge on it. So the water molecules will line up along the zeta potential of the glycocalyx of the red blood cell, and they make it slippery. This is the classic demonstration of the expression slippery when wet, and that facilitates the red blood cells moving through the capillaries. You'll see as we go along, it's almost like a fractal design, and it's beautiful of the sophistication and how all these little parts fit together to make everything work. So here's the red blood cells traveling through a capillary. Here's the endothelial glycocalyx. Glyco again means sugar. Calyx means coating. So it's like sugar coating. It's really sugar protein coating of the endothelial cells. Endothelial cells are the lining cells of the artery. There's additional molecules on there. There's like antithrombin 3 attached to the heparan sulfates. That's also antithrombotic, preventing clots. Okay. So we talked about the endothelial glycocalyx lubricates the capillary as the water molecules are attached loosely to the glycosaminoglycans, negatively charged sugars of zeta potential. Okay, here is a heparan sulfate, again, just showing you tons of sulfates all over the place, lots of negative charge. Here's a cholesterol sulfate with this negative charge there in the plasma membrane of the red blood cell. Here is a sialic acid, again, showing you the negative charge. And that's primarily from a carboxylic acid attached to it. Just think of it as being like a glucose with a carboxylic acid. There's a little more to it, but that's the gist of a sialic acid. And the relevance is the sialic acids of humans are slightly different than those of beef. So when you eat beef, though, it's different, and it's similar enough that our intestinal tract accepts it and will absorb it, and it can be attached to our own cells, but it's different enough that our immune system will recognize it as foreign and cause an autoimmune inflammatory response. And that's what that's called xenosialitis. Xeno meaning foreign, sialitis coming from sialic acid, itis meaning inflammation. So just by eating beef, for example, which has these slightly different sialic acids, you cause some inflammation from xenosialitis, which is something you don't want to do. It's another reason not to eat meat. Okay, here is LDL cholesterol, which is a bridging molecule, positively charged, of big enough size it'll stick the red blood cells together. So the reason you have a blood pressure is to get blood to the top of your brain, your cerebral cortex. Normal blood's like water, and it's easy for the heart to pump it. When your blood is thickened, because you got bridging molecules like LDL cholesterol, for example, thickening your blood, it's like pumping a milkshake to the top of your brain, and pressure has to go up. And then if you have a lot of sodium, that's a vasoconstrictor, inhibits endothelial nitric oxide synthesis, so your arteries are narrowed. Then you have to pump thick blood through narrowed pipes, narrow blood vessels, pressure has to go up. So that causes hypertension. And this is just a perfect example of why I told you all the medical books from all the fancy medical centers, all the Ivy League centers, they're all stupid, they're all ignorant, they're all dishonest, because this is well known what I'm telling you. Red blood cells have a zeta potential. Bridging molecules overcome the zeta potential, stick them together. When they stick them together, they make the blood thick. Thick blood is harder to pump. It's like a milkshake. Pressure has to go up. I tell you this because the books will say 95% of hypertension is essential. Nobody knows the cause of it. That is absolute BS. That is completely untrue and dishonest. In these countries where they eat plant-based diets that are low in fat, they don't get hypertension. You know, they go their whole life with no hypertension. A 75-year-old has the same pressure as a 10-year-old. Okay, so here's LDL cholesterol, the bridging molecule sticks the red blood cells together, then it increases the blood viscosity. Viscosity just means thickness, okay? There's other bridging molecules besides the LDL cholesterol. Fibrinogen, the clotting protein will do it. IgM antibodies, we spoke about that. Uric acid from eating, a lot of meat, that can push it up. Some alcohols will push it up. High fructose corn syrup will elevate serum uric acid. Okay, triglycerides will thicken the blood as well. And then fibrinogen is distorted in the setting of bacterial endotoxins like LPS and LTA after eating, and they'll cause it to change shape and become more prothrombotic. In addition, when you have excessive amounts of free iron in the blood, it'll ferrous redox cycle, from Fe2 plus Fe3 plus, and give off reactive oxygen species in that context, give electrons to it such that it will lead to distortion of the fibrinogen shape. So all of those things are bridging molecules that make the blood thick, and they all contribute to hypertension. But of course, the most common thing is elevated LDL cholesterol. That's why LDL cholesterol is like the biggest risk factor, that and smoking, that and hypertension. But we'll get into that a little later, why that's the case. But what I'm trying to show you is there's a comprehensive, logical, rational reason why high-fat, high-animal food diets cause hypertension. And by the way, just eating animal foods, there's a slight anabolic effect from the animal protein. It has more leucine and methionine, which tend to be rate-limiting steps for protein synthesis, such that you get more protein synthesis after the high-meat diets. It happens more readily. mTOR, the nutrient-sensing pathway, is activated, and when inducing an anabolic state, it calls for more cholesterol to be sent to the tissues, and you get elevated blood cholesterol. That's not widely known, but increased animal protein in your diet will elevate your blood cholesterol. Okay, T. Colin Campbell writes about that in his books, China Study and the other ones. Okay, here's a arterial lining cell. They're called endothelial cells. And the main thing they do is make nitric oxide. Nitric oxide is a gas, diffuses into the arterial lumen and causes activation of platelets, making them nitric oxide blocks activation of platelets. It prevents them from clotting. Whenever you hear the word nitric oxide, think of good blood flow. Okay, the gas diffuses into the smooth muscles in the arterial wall and causes them to relax. Okay, the endothelial cell has a couple other tricks. It makes prostacyclin, which also inhibits platelets. It has antithrombin 3 attached to the heparin sulfate, which is also anti-clotting. It releases a little bit of TPA, tissue plasminogen activator, which is antithrombotic. So it does some other good things. But the most important thing, really it all comes down to what happens with nitric oxide. That's the most important vasodilator in the human body. All these red blood cells are floating together. About more than 99% of the cells in the blood are red blood cells. But there's also a couple of white blood cells. There's also platelets. And they all have zeta potential, so they don't stick together. That's an important point. They have to have that. And then the endothelial lining cells of the arterial wall, these guys all have a zeta potential too. So everything is designed to not stick together under normal conditions. And remember, we just talked about what messes that all up. It gets messed up if you eat a high-fat diet. It gets messed up if you eat a high-sodium diet. It gets messed up if you have elevated uric acid. It gets messed up if you have leaky gut. So you want to avoid all of those things. Okay, here's just a red blood cell traveling through a capillary, and there'll be a zeta potential on the capillary wall. These are cholesterol sulfates. They'll have a negative charge as well. We briefly had talked about leaky gut, and the gist of it is that under normal circumstances, your dietary fibers are taken up by good bacteria. They make short-chain fatty acids, in particular 4-carbon butyrate. That's taken up by the gut lining cells, the enterocytes. They use that to make tight junctions, these TJs. If you don't eat dietary fiber, you're going to be predisposed to leaky gut. Or if you ingest any of these toxic things, things like antibiotics, oils, excessive stress, excessive caffeine, alcohol, the chlorine in municipal tap water. All these things contribute to increased risk of leaky gut. So they're all bad. All right, when you get leaky gut, you don't have these tight junctions. You'll get bacterial endotoxins like LPA getting across the gut wall and LTA from gram-positive bacteria. And these are endotoxins. They occur after eating, so it's called postprandial endotoxemia. These make the blood more predisposed to thrombosing, okay? And they have a powerful effect to do that. You don't want leaky gut. This is also partly why people with autoimmune diseases, which are typically caused by leaky gut, have an increased incidence of thromboembolic events, of blood clotting events. DVT, deep venous thrombosis in the leg, pulmonary embolism, where the DVT gets broken off and embolizes, travels to the lung, myocardial infarction, and stroke. Okay, so here is a person with the LPS and the LTA, bacterial endotoxins, getting into the blood after eating because of leaky gut. Also, people who eat a Western diet tend to have higher levels of iron, free iron in the blood. You can get an indicator of that by elevated serum ferritins. Okay, that's why I try to keep my serum ferritin about 30 to 80, even though they'll tell you normal is up to about 380 or something. Okay, amyloid clotting means that normally the fibrinogen is alpha helix in the secondary protein structure like a slinky, and those are hard to stack up. But when you've got LPS or LTA in the blood or excess free iron producing reactive oxygen species, okay, like the Fenton reaction and all that, then the alpha helices will flatten out and they can stack up like a deck of playing cards. That's called an amyloid change, amyloid transition from alpha helix cylinders like slinkies to being flat like playing cards, and then they'll stick together, the flat beta-pleated sheets, and that'll form a clot. It'll precipitate out a solution. The bigger a molecule is in aqueous solution, the more likely it is to precipitate out. Precipitation of blood proteins is formation of clots. And they form a particular clot that's quite refractory to lysis. It's called dense matted deposits. Etheresia pretorius and Douglas Keller are the ones that figured out a lot of this stuff. It's incredible research. They deserve a Nobel Prize, but they'll probably never get it because corporations want to keep that secret. Okay, Roy Swank, the great neurologist who worked with Dr. McDougall and did all this work on how high-fat diets predisposed to tissue hypoxia, and he felt that this was damaging the blood-brain barrier and facilitating opening up of the blood-brain barrier to lead to multiple sclerosis. That was the theory of Roy Swank. He also measured in a hamster brain that after a high-fat meal, there was a 30% drop in the oxygen delivered to the brain tissue itself. Okay, additional work has been done along these lines of feeding animals and people high-fat meals and then seeing the effect it has on blood flow. Peter Quo did a lot of this work in the 1950s. He's a cardiologist from Pennsylvania who worked with patients with cardiac angina and showed after eating a high sat-fat meal at about 3 to 7 hours, their blood was in maximum blood sludge, and they were most likely to have chest pain, coronary events. Okay, Ray Rosenman and Meyer Friedman are ophthalmologists, and they found by looking at the eyes with an 80-fold microscope when the patients ate these high-fat diets, and it included omega-6 fats, these cooking oils, they had a markedly diminished blood flow to their tissues. Okay, you can watch this one particular movie. Just go to the Dr. McDougall YouTube channel. The movie's called Blood Sludge. Before and after eating a fatty meal. It's only about 50 seconds, but you remember it the rest of your life. This is from a paper of Dr. Swank showing the red blood cells clumping together after eating a high-fat meal. Okay, diabetes, insulin resistance is primarily caused by increased dietary fat, especially sat fat. And then diabetes itself is subsequently damaging to the arterial wall. Hypertension from the high pressures is damaging to the arterial wall. So here's a normal capillary. The red blood cells are flowing through like this. The little yellow barrier is called the capillary basement membrane, attaches to the endothelial cells, holds them in place. These green cells are the vascular smooth muscle cells. The blue circles are the oxygen traveling from the red blood cell to the tissue, in this case an axon or neuron in the brain. In the setting of diabetes, you'll get a thickened capillary basement membrane. The yellow part here is thickened, and that's going to decrease how much oxygen is able to reach the tissues. Okay, so it decreases oxygen delivered to the tissues. Hypertension will lead to thickening of these muscles. They'll become hypertrophic over time. There'll also be some scarring and collagen being laid down in this arterial wall. But the point I'm making is, you see the progressively worsening screw job that's happening here? Number one, as the patient gets older, they tend to make less nitric oxide. So they got less vasodilator, less antithrombotic, antiplatelet chemical. Number 2, the diabetes is thickening the capillary basement membrane. That's going to decrease oxygen delivery. Number 3, hypertrophy chronically and scarring of the wall due to the hypertension. That's going to decrease oxygen delivery. Number 4, the high sodium meal is going to vasoconstrict. That's going to decrease oxygen delivery. Number 5, the fat sticking the red blood cells together, overcoming the zeta potential. That's going to decrease oxygen delivery. Number 6, the postprandial endotoxemia with gram-negative endotoxin, LPS. That's going to make the blood thicker. The LTA, that's going to make the blood thicker. The progressive iron overload that occurs with age, that's going to make the blood thicker. Okay, the uric acid, if they're eating high fructose corn syrup, that's going to make the blood look sicker. The lack of dietary plants, meaning the lack of magnesium and the lack of sodium, lack of magnesium and lack of potassium, that's going to lead to vasoconstriction. I'll come to that in a moment. But what I'm trying to say is it's not one thing. It's like 10 things or more. They're all adding up to damage blood flow, to damage the cells, to make them hypoxic, deficient in oxygen. So a lot of people feel like, oh, I'm doing okay. I'm not as fat and stupid as my cousin. But what they don't understand, they're quite routinely, got 10 to 15 things damaging their health. And, if they're smart, they'll start turning it around soon. Otherwise, they're screwed. Okay. Most people, they never get better. They just keep getting worse, and they don't do well, and they're fat, sick, and stupid, and there's really nothing anybody can do about it, and they don't understand. They won't change. Their doctor doesn't know, and it's kind of sad and pathetic. That's what happens to most people. So to avoid that game, you just need to, learn a few things here. Become a low-fat, low-sodium, no-oil vegan. Okay. It's not rocket science. Just the proper attitude is an attitude of gratitude. Thank God there's something I could do. I'm not inevitably screwed. Okay, this is just another picture of the glycoproteins on the glycocalyx. Okay, the higher the red blood cells, the higher the hematocrit. So the larger the percentage of cells in the blood being red blood cells and relative to the amount of plasma, the higher the hematocrit, the higher the blood viscosity. And where this relates is, let's say you got one of these Tour de France cyclists. They would take epoetin, which makes red blood cells, and elevates the hematocrit. And that would give them a little more oxygen delivering capacity in the middle of a race. But when they're not racing, then it would drop their oxygen delivery and make their blood too thick. So it's not good. The higher the hematocrit, the higher the blood viscosity. Over 99% of blood cells are red blood cells. Okay. If you put them in a test tube, sediment them out, the red blood cells fall to the bottom. That's the hematocrit. The little white part here, the buffy coat, those are the white blood cells. And then the plasma is above that. It's a normal peripheral smear of blood cells. The spleen is like the graveyard for red blood cells. Typically, they're removed after 120 days. And the reason is, again, remember, they're 7 microns in diameter. They have to go through a 5-micron capillary in the regular tissues. But in the spleen, they'll have to go through 3-micron capillaries, and they just will burst if they're too stiff. They're not flexible enough to get through. Okay, here's normal blood flow. It's usually going to be laminar, meaning sort of a parabolic velocity profile. With the red blood cells in the center. Just hold your hand out, it makes sense. Red blood cells in the center, white blood cells, and then on the ends, the plasma in contact with the vessel wall. Okay, the higher the blood viscosity, the thicker the blood, the higher the blood pressure. The higher the blood pressure, the more it's going to damage the arterial walls and cause more atherosclerosis and put you in a setup for potential development of a vicious cycle and worsening atherosclerosis. Okay, the endothelial cells have the ability to sense direction of flow. They got these little hair-like extensions. When you have excessive amounts of hypertension, excessive amounts of high blood pressure, it causes excessive turbulent flow, and there'll even be these retrograde eddy currents at the bifurcations. When you have an excessive amount of this abnormal flow, you will then confuse the arterial lining cells, endothelial cells, and they will shed their antithrombotic glycocalyx, and it'll have remaining underneath it this prothrombotic glycocalyx, to which red blood cells and white blood cells will attach and you'll form a clot. That's how atherosclerosis is initiated. Then it gets covered up by endothelial precursor cells, EPCs, and this is how the blood clot of atherosclerosis becomes subendothelial. Okay. Here's a normal plasma membrane potassium sodium ATPase. Normally you're pumping 3 sodium out, so you're pumping out 3 positive charge, then you're pumping in 2 potassium, that's 2 positive charge. So a net amount is 3 going out and only 2 coming in. And because of that, you're going to develop a negative charge inside the cell. Typically, let's say in a neuron, about negative 65 millivolts. Okay, you need to know that. You need to have that general idea. And what you also should remember, here's an easy way to remember it. 65 is about like 66, 2/3. So That's about how much energy neurons will use for this sodium potassium ATPase. Half to 2/3 of their energy will go to this pump. This pump is super important because it is the battery used for the entire cell to do work. It's the electrical energy. The human body is a lot more intelligent than we are. Okay, so it invented batteries a long, long time ago. And these ions have to be in relatively normally expected amounts in order for these pumps to function optimally. Okay, you need magnesium because magnesium holds the ATP together. I'll explain how that works in just a moment. All right. You normally in your diet should eat at least 5, preferably 10 times more potassium than sodium to have these gradients optimized. It's going to lead to an electrical chemical gradient. The electrical component means the slight negative charge inside the plasma membrane, like negative 65 millivolts. The chemical gradient refers to a concentration gradient of sodium. It's going to be higher in concentration outside the cell by about a factor of 10 than inside the cell. In a moment, we're going to talk about calcium. Calcium is sort of the aristocrat of ions. Sodium, potassium, magnesium, they are the minimum wage workers. Just do as you're told. You're not allowed to have an opinion, okay? The calcium is aristocrat. It comes in, it just bosses everybody around. When calcium enters a cell, it automatically makes the cell do whatever is the main thing that cell does. Here's just an example of magnesium, how magnesium is located in the center of the plant. And so what am I getting? What's the big picture? Why am I going through all this? Because plants have all the good stuff. Plants are high in potassium. Plants are high in magnesium. Plants are high in antioxidants. Plants are high in fiber. Plants are high in nitrates, the precursors to making nitric oxide through the oral pathway. Okay, that's all the good stuff. They're also high in vitamin C, one of the antioxidants. So you need to know that magnesium is in the center chlorophyll, and it's a good thing. If you remember magnesium, M for magnesium, M for mellow, it mellows you out. It also inhibits the brain neurotransmitter receptors for glutamate. So it inhibits the NMDA receptor for glutamate. That's important. So M is for mellow out. That's worth remembering. M is for mellow out. Mellow out your arteries, mellow out your brain, mellow out your personality. So the magnesium has a +2 charge, 2+ charge. And so that enables it to attach to the outer phosphates on an ATP. ATP is adenosine triphosphate. There's 3 phosphates. With all the negative charges here, these phosphates want to repel each other. The phosphate wants to jump off the molecule. And it's almost like a bucking bronco horse. And the magnesium is holding, saying, whoa, sit tight, whoa, sit tight, until I need you for this chemical reaction. So the magnesium makes it possible. If you're deficient in magnesium, there's lots and lots of enzymes that require an ATP held together by magnesium. So you'll have a lot of things become dysfunctional if you don't get enough magnesium. Where do you get it? From eating plants, okay? And if you don't eat enough potassium, you also mess up those electrochemical gradients in your cells, and you won't function optimally. So normally in the blood in the extracellular matrix, ECM, you're going to have sodium about 140 and then about 14 inside the cell. So it's about a 10-fold difference. Okay, potassium is going to be about 150 inside the cell and about 4 outside. The more interesting thing is calcium. Calcium is like 10,000 times higher in the extracellular matrix than it is in the cell cytoplasm. So you got to really regulate that closely or you run into problems. Na stands for natrium, which is Latin for sodium. K stands for kalium, which is Latin for potassium. Okay, and what it really ends up coming down to for brain health and brain function is that just like in the ancient days, all roads led to Rome, in the human body in the modern world, most of these problems, they lead to elevated cytoplasm calcium. And the classic one is if you eat way too much dietary sodium, not enough potassium, your plasma membrane pumps and gradients become dissipated and you'll accumulate calcium in your cytoplasm. If you have tissue hypoxia, lack of oxygen, you can't make enough ATP, and you can't run all your pumps to pump calcium out of the cytoplasm. Cytoplasm calcium will accumulate. Mitochondrial inhibitors will lead to the same thing because you can't make enough ATP. Circuit inhibitors will do it because you can't pump the calcium out of the cytoplasm into the endoplasmic reticulum. Sarcoplasm, endoplasmic reticulum, calcium ATPase. You can't do it. Lack of dietary potassium and magnesium, then your pumps aren't going to run effectively. You get more calcium in your cytoplasm. You'll get more hypertension. You ingest excessive caffeine, it gets worse. You don't get your sleep, it gets worse. You're stressed out, it gets worse. Okay, here's a more extensive drawing of a functional cell. Then you've got this plasma membrane calcium ATPase running to maintain your negative 65 millivolt resting membrane gradient. You got your electrochemical gradient of sodium. You got your knock exchanger for pumping out calcium quickly whenever you need to. You have a backup plasma membrane calcium ATPase, but it's much slower. And you maintain this giant concentration, different, like a 10-fold to 15-fold calcium outside the cell. Well, 15,000 times higher outside the cell compared to inside the cell. Okay, so calcium wants to get into that cell, but it's not allowed to. This is just showing you an atherosclerotic plaque and how it can be at least partially reversed. Given that it's a blood clot and blood clots can resorb, they do that all the time after trauma, for example. The fatty core can be absorbed, the necrotic dead tissue core can be reabsorbed. The calcium is probably not going to go away, even though some people say that there's now been some reports of calcium gradually going away. It's going to be a pretty slow process. So you can partially reverse atherosclerosis by shrinking the plaque. That's one way. Number two, just by eating a healthy diet, the endothelial cells start to function better. They release more nitric oxide, which causes vasodilator, and it's antithrombotic, inhibiting platelet activation. So you'll get improvement very quickly within just a couple of days. Okay, here's the great Prevent and Reverse Heart Disease book by Caldwell Esselstyn. And what are some things he says? He says, nitric oxide is the most powerful vasodilator in the body. Nitric oxide is the life jacket of your arteries. The number one goal of good arterial function is to maintain nitric oxide. As we get older, our bodies produce less nitric oxide, but the body has another way to produce nitric oxide from plants. Eat green vegetables 6 times per day to keep your arteries bathed in the nitric oxide. Okay, well, that's good. So anyways, here's Prevent and Reverse Heart Disease by Esselstyn, the classic book, and he's got the best results of anybody in the world by a factor of over 30. I mean, there's nothing even close. Okay. This is just the oral pathway of nitric oxide production, whereby you eat the greens, they've got nitrate, NO3. Your tongue has bacteria at the back that convert the nitrates, and this should be nitrite, that should be a letter I there, to NO2. And then the stomach acid facilitates the conversion of the NO2 to NO for nitric oxide. And that vasodilates arteries all over your body. It's a good thing. If you don't want to be using F- in your toothpaste or F- in your water, your mouthwash, because that will destroy the bacteria on the back of the tongue, and then they won't be able to initiate this production of nitrates and nitric oxide from the greens. They don't want that. PPI medications can worsen this process. Antacids can work in this process, and you won't get as much of a benefit. Okay, so that's all I've got for this part 4 of is it all the same disease? And the point I'm making is, yes, it is. Most of the common diseases in Western civilization, the common chronic diseases, they're all just manifestations of the same problem, eating these high-fat, high-sodium diets as well as the processed foods and being exposed to the toxins in water that's not filtered.